Your feet are telling you something, and most doctors aren't listening. If you've been dealing with cold feet, cracked heels, swelling, pain, or strange changes in your skin and toenails, there's a very good chance one of three conditions is behind it: a thyroid problem, Sjogren syndrome, or fibromyalgia. Now, here's what makes this complicated. All three of these conditions can make your feet look and feel absolutely terrible. And on the surface, some of the symptoms can seem almost identical. But the underlying causes, and more importantly, the solutions, are completely different. So today, we are going to go deep. I'm going to walk you through 6 key signs to look for in each of these 3 conditions. By the end of this video, you'll know exactly which type of sick feet you might be dealing with, and what to do about it. If that sentence just landed for you, if something in what I've described so far sounds familiar, I've put together a symptom map that shows exactly how this condition progresses, what shows up at each stage, and where the standard tests are most likely to miss it. Type symptom map in the comments right now and I'll send it to you directly. Because what I'm about to show you next is why that map matters more than most people realize, and why the stage you're in changes everything about what happens next. Let's start with what I call thyroid feet. Part 1. Thyroid feet. What is happening in your body? When your thyroid is underperforming, a condition called hypothyroidism, it slows nearly every metabolic process in your body. Your cells don't get enough energy, your skin stops renewing itself properly, your circulation drops, and your body struggles to maintain normal fluid balance. All of this shows up in your feet in very specific ways. The good news? These changes are 100% reversible once the thyroid is properly optimized. Thyroid sign number 1, yellowing of the soles. One of the first things thyroid patients notice is a change in color, specifically a yellowing or yellowish-orange tint to the soles of the feet. This happens because low thyroid function slows down the conversion of beta-carotene into vitamin A. Beta-carotene is the compound that gives carrots their orange color. When your body can't properly convert it, it builds up in your blood and skin. And because it tends to concentrate in thicker areas of skin, like the soles of your feet, those areas take on a distinctly yellow-orange tint. On its own, this is relatively harmless. But it is a powerful visual signal that something is wrong with your thyroid. Don't ignore it. Thyroid sign number 2, cracked and damaged heels. Your thyroid controls the moisture and oil production of your skin. When thyroid function drops, your skin becomes rough, itchy, and scaly, and this is especially visible on the heels. These heel cracks can run deep. They can become extremely painful. And they significantly increase your risk of developing skin infections. Many thyroid patients find that no amount of moisturizer fully solves the problem, because moisturizer treats the surface, while the real cause is your thyroid function driving down the skin's ability to hydrate itself from the inside. Products like Aquaphor and exfoliating heel scrubs can help manage the discomfort. But until the thyroid is addressed, the cracks keep coming back. Thyroid sign number 3, swollen feet and ankles. Swelling, or edema, is extremely common in thyroid patients, and it has a specific mechanism. Hypothyroidism leads to a buildup of compounds called glycosaminoglycans in the tissues. These are water-loving molecules that can attract almost 100 times their weight in water. Wherever they go, water follows. And in thyroid patients, this buildup tends to be most prominent in the feet and ankles, getting noticeably worse as the day goes on. This type of swelling isn't from a heart or kidney problem. It's directly tied to your thyroid status. That said, this is one of the symptoms that can sometimes persist even after you begin treating your thyroid, so don't be discouraged if it takes extra time to resolve. Thyroid sign number 4, brittle toenails. Your toenails require a steady supply of nutrients and blood flow to stay strong and healthy. Thyroid dysfunction disrupts this process, and it shows up in the nails. Thyroid patients may develop toenails that are brittle, crack easily, have ridges, grow slowly, become discolored, or in some cases actually begin to separate from the nail bed. The exact presentation varies depending on your genetics, but one thing is consistent. These nail changes open the door to secondary problems, including fungal infections, which are already harder to clear in thyroid patients. Pay close attention to your toenails, not for vanity reasons, but because they are a window into what is happening with your thyroid. Thyroid sign number 5, cold feet, the positive sock sign. This is the one that frustrates thyroid patients and their partners probably more than any other symptom. When I talk about cold feet in thyroid patients, I'm not just talking about temperature. I'm talking about an unreasonable level of discomfort and irritability when the feet get cold, something that actually has a medical name: cold intolerance. Cold intolerance is one of the most classic and recognizable signs of hypothyroidism. When it specifically affects the feet, I have a name for it. I call it the positive sock sign. If you have to wear socks to bed every single night just to keep your feet from feeling unbearably cold, and this happens even in summer, there is a very good chance your thyroid is slowing your body's ability to generate and maintain heat. Thyroid sign number 6. Leathery, doughy feeling skin. This is a sign of long-standing, chronic hypothyroidism, and it's caused by slow cell turnover. When your thyroid is underactive, your skin cells don't shed and renew the way they should. Instead, they stack up on top of each other, making the skin appear thicker, feel leathery, or have a doughy, puffy quality, especially on the feet and lower legs. The good news is that this symptom takes years to develop, so if you were recently diagnosed, you're unlikely to be seeing this yet. The not-so-good news is that it is also one of the slowest symptoms to reverse once thyroid treatment begins. How to reverse thyroid feet? A 3-step plan. Step 1. Get the right tests. TSH alone is not enough. TSH tells you how much thyroid-stimulating hormone your pituitary is releasing. It's an indirect marker at best, and a poor one for assessing what's actually happening inside your cells. For a complete picture, you need TSH, free T3, free T4, and reverse T3. Pay close attention to free T3 and free T4 specifically. Both values need to be in the high normal range, not just normal, and certainly not low normal. If they're not there, you've found your problem. Step 2. Optimize your thyroid hormones. Most people with hypothyroidism are only prescribed levothyroxine, which is T4. That is a starting point, not a destination. T4 must be converted to T3 inside your cells to actually work, and that conversion step fails in many thyroid patients. The goal is to combine T4 with T3 and T2. T3 requires a prescription, but T2 is available over the counter. It's the combination of all three that allows full thyroid optimization. Step 3. Support with targeted supplements. Thyroid glandulus. These are derived from bovine thyroid tissue and provide the full spectrum of thyroid hormones, prohormones, and enzymes found naturally in the gland. They complement thyroid medication and can help optimize thyroid function. T2 thyroid hormone. T2 helps T3 work more effectively, so even if T3 levels are not yet optimal, supplemental T2 can help amplify what T3 is doing. Silicon as MMST, monomethylsilinetriol. This compound supports thyroid-related changes to hair, skin, and nails. Most thyroid patients are deficient and benefit significantly from supplementation. Collagen peptides as Verisol. This specific collagen peptide has been clinically studied for its ability to rebuild damaged skin and improve connective tissue, a perfect match for the skin changes in thyroid feet. Part 2. Sjogren's feet. What is Sjogren's syndrome? Sjogren's syndrome is a systemic autoimmune disease. In Sjogren's, the immune system mistakenly attacks moisture-producing glands throughout the body, most classically the salivary glands and tear ducts, leading to the hallmark symptoms of dry mouth and dry eyes. But Sjogren's is not just about dryness. It is a full-body inflammatory condition that affects nerves, skin, joints, and connective tissues everywhere, including the feet. Sjogren's is far more common than most people realize. It's estimated to affect between 1 and 4 million Americans, and it predominantly affects women. It is also notoriously underdiagnosed, often taking years, sometimes more than a decade, to identify. When Sjogren's affects the feet, it does so through several distinct mechanisms: immune-driven inflammation, nerve damage, called peripheral neuropathy, and profound dryness due to glandular destruction. Understanding these mechanisms will help you recognize what you're looking at. Sjogren's sign number 1. Extreme dryness and fissuring of the skin. The most distinctive feature of Sjogren's feet is a level of dryness that goes far beyond what you'd expect from simple dehydration or even hypothyroidism. Because Sjogren's destroys moisture-producing glands throughout the body, the skin literally loses its ability to maintain hydration at a glandular level. In the feet, this manifests as intensely dry, tight, cracked skin, particularly on the heels and the balls of the feet. The cracks can be painful, deep, and prone to bleeding. What makes Sjogren's fissuring different from thyroid-related cracking is the quality of the dryness. Thyroid patients often describe their skin as rough and scaly. Sjogren's patients describe theirs as almost papery, almost like the skin is losing its fundamental ability to hold moisture. And just as Sjogren's causes dry eyes that require prescription eye drops rather than simple artificial tears, the dry skin of Sjogren's often doesn't fully respond to standard moisturizers. Sjogren's sign number 2, burning, tingling, or numbness, small fiber neuropathy. This is one of the most significant and often overlooked aspects of Sjogren's in the feet. Peripheral neuropathy, specifically small fiber neuropathy, is a well-documented complication of Sjogren's syndrome. Small fiber nerves are the tiny sensory nerves that run through your skin and feet. When Sjogren's inflames and damages these nerves, patients experience burning, tingling, electric shock sensations, or numbness, often starting in the feet and working upward. This is called a length-dependent neuropathy, meaning the longest nerves in your body are affected first, which is why the feet and lower legs are almost always the starting point. This symptom is often mistaken for diabetic neuropathy or fibromyalgia. The key distinguishing feature with Sjogren's is that the neuropathy tends to be accompanied by other autoimmune signs, dry eyes, dry mouth, joint pain, fatigue, and can be confirmed with a skin punch biopsy that measures small fiber nerve density. If you are experiencing burning or electric pain in your feet and nobody has figured out why, Sjogren's neuropathy needs to be on the list. Sjogren's sign number 3, swollen, puffy feet and ankles, but from inflammation. Like thyroid patients, Sjogren's patients can develop swelling in the feet and ankles. But the mechanism is different. In thyroid patients, swelling comes from glycosaminoglycan accumulation, a metabolic process. In Sjogren's patients, swelling tends to be driven by inflammation, immune complexes depositing in soft tissues and blood vessel walls, and lymphatic involvement due to the systemic autoimmune process. Some Sjogren's patients also develop what is called vasculitis, inflammation of small blood vessels, which can cause visible redness, discoloration, or purplish spots on the lower legs and feet alongside the swelling. This is a sign the immune system is attacking blood vessels directly, and it warrants urgent medical attention. If your swelling is asymmetrical, comes with redness or skin discoloration, or is accompanied by other systemic autoimmune symptoms, think Sjogren's rather than thyroid. Sjogren's sign number 4, joint pain in the feet, arthralgia. Sjogren's is a connective tissue disease, and joint involvement is extremely common. In the feet, this typically presents as pain and stiffness in the small joints, the toe joints, the midfoot joints, and the ankle joint. The pattern of pain is often migratory, it moves around rather than staying fixed in one location, and it tends to be worse in the morning or after periods of rest, similar to rheumatoid arthritis. This is not coincidental. Sjogren's and rheumatoid arthritis share significant immunological overlap, and some patients have features of both. Importantly, Sjogren's joint pain in the feet is an inflammatory joint pain, not a mechanical or structural one. Anti-inflammatory medications and disease-modifying agents that address the underlying immune dysfunction are far more effective than standard pain relievers. Sjogren's sign number 5, nail changes, but with an autoimmune twist. Nail changes do occur in Sjogren's, but they have a different character than thyroid nail changes. While thyroid-related nails tend to be brittle and break easily due to nutrient and circulation deficits, Sjogren's nail changes often reflect the underlying connective tissue and inflammatory nature of the disease. Patients may develop ridges, pitting, or unusual patterns of discoloration. In some cases, when vasculitis is involved, there can be small dark spots under the nail, called splinter hemorrhages, caused by tiny bleeds in the nail bed capillaries. Nail changes in Sjogren's are also more likely to appear alongside other autoimmune nail changes, such as changes in the cuticles or the nail fold, because the immune attack doesn't just target the thyroid, it targets multiple tissues simultaneously. Sjogren's sign number 6, extreme fatigue that makes foot pain worse. This one might seem out of place, but it is critically important to understand. Sjogren's causes a level of systemic fatigue that is disproportionate to what most people would expect. This isn't tiredness from a bad night's sleep. This is a bone-deep, neurological exhaustion that makes every physical symptom feel more intense, including the foot pain, neuropathy, and joint discomfort described above. The reason this matters for your feet specifically, when Sjogren's fatigue is severe, patients often reduce activity and spend more time off their feet, and then when they do stand and walk, the pain and stiffness are dramatically worse because the feet have stiffened with disuse. Recognizing the fatigue as part of the autoimmune picture, rather than dismissing it as depression or laziness, is essential for managing Sjogren's feet effectively. How to address Sjogren's feet. Step 1. Get properly diagnosed. Sjogren's diagnosis requires specific blood tests, ANA, antinuclear antibody, anti-Ro SSA, and anti-La SSB antibodies, as well as a clinical evaluation. A lip biopsy or salivary gland biopsy may be performed to confirm. If you have dry eyes, dry mouth, fatigue, and any of the foot symptoms described above, push your doctor to test for Sjogren specifically. Step 2. Address the autoimmune inflammation. Disease-modifying medications like hydroxychloroquine, Plaquenil, are commonly used for Sjogren's and can significantly reduce systemic inflammation, including the joint pain, neuropathy, and swelling in the feet. For severe cases, biologics may be appropriate. Step 3. Neuropathy-specific care. For the small fiber neuropathy in the feet, neurologists may recommend alpha-lipoic acid, B-complex vitamins, especially B12, or prescription medications like gabapentin or duloxetine. Some patients benefit from low-dose naltrexone, which has shown promise in autoimmune-related neuropathic pain. Step 4. Aggressive skin care for Sjogren's dryness. Standard moisturizers will not be enough. Sjogren's patients need to use emollient-rich barrier creams, products with ingredients like urea, ceramides, or lanolin, applied multiple times per day. Wearing moisture-locking socks after application at night can significantly help. Dry environments make Sjogren's dryness worse, so indoor humidification is a useful addition. Part 3. Fibromyalgia feet. What is fibromyalgia? Fibromyalgia is a central sensitization syndrome. Unlike thyroid disease, which is a metabolic endocrine disorder, or Sjogren's, which is a systemic autoimmune disease, fibromyalgia is a disorder of how the central nervous system processes pain. In fibromyalgia, the brain and spinal cord amplify pain signals, a process sometimes called central sensitization or turning up the pain volume. This means that sensations that wouldn't bother most people, light pressure, temperature changes, even clothing on skin, can register as genuinely painful for fibromyalgia patients. The feet, being one of the most nerve-dense and high-use parts of the body, are almost universally affected in fibromyalgia. And because fibromyalgia doesn't cause visible inflammation or tissue damage on standard tests, it is chronically dismissed, which means patients go years without answers. Fibromyalgia sign number 1. Burning foot pain, the walking on glass sensation. The most commonly reported fibromyalgia foot symptom is a burning, aching, or hypersensitive pain in the soles of the feet that patients often describe as feeling like they are walking on broken glass, hot coals, or gravel. This pain is neurological in origin. The nerves in the feet are not actually damaged the way they are in Sjogren's neuropathy. Instead, the central nervous system is interpreting input from those nerves as pain when it shouldn't be. This is a key distinction. In Sjogren's neuropathy, the nerves are being structurally damaged. In fibromyalgia, the nerves are intact but the pain processing is dysregulated. The burning sensation in fibromyalgia feet tends to be bilateral, both feet at once, and is often worst first thing in the morning or after periods of rest, then temporarily eases with movement before worsening again with prolonged standing or walking. Fibromyalgia sign number 2, plantar fasciitis that won't respond to treatment. Plantar fasciitis, pain along the bottom of the foot, especially at the heel, is extremely common in the general population. In fibromyalgia patients, it is both more common and dramatically more painful than it should be, and it notoriously fails to respond to standard treatments. The reason is central sensitization. When a fibromyalgia patient develops even mild plantar fascia strain, their brain amplifies the pain signal far beyond what the tissue damage warrants. Standard plantar fasciitis treatments, stretching, orthotics, cortisone injections, address the tissue. But when the primary driver is neurological amplification, these interventions provide incomplete relief at best. If you have been treated repeatedly for plantar fasciitis without success, and you also experience widespread pain, fatigue, brain fog, or sleep disruption, fibromyalgia may be the actual diagnosis driving your foot pain. Fibromyalgia sign number 3, allodynia, pain from things that shouldn't hurt. This is one of the most distinctive and diagnostically important features of fibromyalgia feet. Allodynia means pain from stimuli that should not be painful. In the feet, fibromyalgia patients commonly report that wearing socks feels painful, that certain shoe materials feel unbearable, or that even a light touch on the top or sides of the feet causes a disproportionate pain response. Some patients cannot tolerate bedsheets touching their feet at night. Others find that temperature changes, a cold floor, a slightly cool room, trigger immediate, intense foot discomfort. This is the central nervous system at work, not structural foot pathology. You won't see anything wrong on an X-ray or MRI. But the pain is absolutely real. Fibromyalgia sign number 4, morning stiffness and gel phenomenon. Fibromyalgia patients almost universally report profound stiffness in the feet and lower legs when they first get out of bed in the morning or after sitting for extended periods. This is sometimes called the gel phenomenon, named because, like gelatin, the tissues seem to set after being still for a period of time. The feet and ankles feel locked, thick, and extremely painful for the first several minutes to half an hour of movement. What makes this different from the morning stiffness of rheumatoid arthritis or Sjogrens, which is driven by joint inflammation, is that fibromyalgia morning stiffness tends to ease more quickly with movement, and there is no accompanying joint swelling, redness, or warmth. The stiffness is muscular and neurological, not inflammatory. Fibromyalgia sign number 5, restless legs and foot twitching at night. Sleep disturbance is one of the core features of fibromyalgia, and restless leg syndrome, RLS, is significantly more common in fibromyalgia patients than in the general population. Restless leg syndrome causes uncomfortable sensations in the legs and feet, creeping, crawling, burning, or itching feelings, that are almost exclusively triggered by rest and relieved by movement. This creates a cruel cycle for fibromyalgia patients. They need rest to manage their pain, but the act of resting triggers RLS symptoms that make sleep impossible. Some fibromyalgia patients also experience nocturnal myoclonus, involuntary jerking or twitching of the feet and legs during sleep, which further disrupts sleep quality and leads to the non-restorative sleep pattern so characteristic of fibromyalgia. If your foot symptoms are worst when you're trying to rest or sleep, and they compel you to keep moving, restless leg syndrome in the context of fibromyalgia is a very likely explanation. Fibromyalgia sign number 6, swollen feeling feet with no visible swelling. Many fibromyalgia patients describe their feet as feeling swollen, puffy, or pressurized, as if they were inflated like a balloon, even when there is no visible edema present. This is a phenomenon of central sensitization. The nervous system is interpreting the normal pressure of blood flow and lymphatic fluid in the feet as excessive, as swelling and pressure, even when there is nothing objectively wrong. This symptom is deeply frustrating for fibromyalgia patients because it doesn't show up on tests, doctors can't see it, and it's easy to dismiss. But it is a real sensory experience created by a dysregulated nervous system. It is also, notably, different from thyroid edema, which is visible and measurable, and Sjogren's inflammation, which may show markers in the blood or visible changes in the tissues. How to address fibromyalgia feet. Step 1. Confirm the diagnosis. Fibromyalgia is diagnosed clinically, based on widespread pain lasting more than 3 months, tenderness at specific tender point sites, and the exclusion of other conditions that could explain the symptoms. It is critical to also rule out thyroid disease and Sjogren syndrome, both of which can mimic and coexist with fibromyalgia. Step 2. Address central sensitization directly. The only treatments that consistently help fibromyalgia feet are those that target the central nervous system, not the foot itself. These include low-dose naltrexone, LDN, which modulates glial cell activity and reduces neuroinflammation. Duloxetine, Cymbalta, and milnacipran, Savella, both FDA approved for fibromyalgia. Pregabalin, Lyrica, approved for fibromyalgia-related pain. Cognitive behavioral therapy, CBT, which helps restructure the brain's pain response. Graded exercise therapy, starting extremely slowly to avoid post-exertional flares. Step 3. Sleep optimization is non-negotiable. Because non-restorative sleep is both a cause and consequence of fibromyalgia, restoring sleep quality is essential for reducing foot pain. This may include addressing restless leg syndrome with medications, improving sleep hygiene, or using low-dose tricyclic antidepressants at bedtime to improve sleep architecture. Step 4. Desensitize the feet. Sensory desensitization techniques, working with a physical therapist who specializes in central sensitization, can help gradually retrain the nervous system's response to foot stimulation. This might include graded exposure to different textures, temperatures, and pressures in a controlled and progressive way. Step 5. Foot-specific comfort measures. While they don't address the root cause, certain measures can reduce day-to-day foot suffering in fibromyalgia. Extra soft, seamless socks, wide, cushioned footwear with minimal pressure points, warm foot soaks before bed, and topical lidocaine or capsaicin for localized burning pain. Here is a quick reference to help you identify which type of sick feet you may be dealing with. Thyroid feet, yellow soles, cracked heels, ankle swelling that worsens at day's end, brittle toenails, cold intolerance, and needing socks to sleep, leathery or doughy skin. Improves directly with thyroid hormone optimization. Sjogren's feet, papery dry skin and deep fissures, burning and electric nerve pain, small fiber neuropathy, inflammatory swelling sometimes with discoloration, migratory joint pain and stiffness, nail changes including possible splinter hemorrhages, severe systemic fatigue. Driven by autoimmunity, requires immune modulating treatment. Fibromyalgia feet, burning walking on glass pain, plantar fasciitis that doesn't respond to treatment, pain from light touch or socks, allodynia, morning stiffness that eases with movement, restless legs and nighttime twitching, subjective swelling with no visible edema. Driven by central sensitization, requires neurological treatment, not foot treatment. It is also worth noting that these conditions can and do overlap. Many Sjogren's patients also develop fibromyalgia. Many thyroid patients have low-grade autoimmune involvement that triggers secondary fibromyalgia-like symptoms. Getting a proper, thorough diagnosis is the foundation of getting better. Your feet are giving you a map. Now you know how to read it.